Myself, Dr. Abu MD Mustaque, practicing diabetologist in Bardhaman, West Bengal. Actually, I am practicing in rural Bardhaman. So that's why many patients of type 2 diabetes mellitus and other comorbidities and other like hypertension, many more patients available here.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
So in my experience, Imeglimin offers a novel approach to type 2 diabetes mellitus management by targeting mitochondrial function, which is distinct from the mechanism of traditional anti-diabetic drugs. Its ability to enhance insulin secretion and sensitivity. It inhibits hepatic gluconeogenesis and support pancreatic beta cell function makes it a valuable addition to our treatment arsenal, particularly for patients who have not achieved optimal control with existing therapies.
In what specific patient population do you see the greatest benefit of using Imeglimin?
Now, the Imeglimin is beneficial for patients who have uncontrolled hyperglycemia with multiple metabolic dysfunctions, such as those with significant insulin resistance or those at high risk for diabetic complications. It also offers a promising option for patients who experience adverse effects like GI intolerance with other medication like metformin or glimepiride, and also require additional glucose lowering agents to achieve target glycemic levels.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real world case if you have.
So in my clinical experience, incorporating Imeglimin as an individual and add-on reduce the dose of existing medication or reduce the dose of insulin. So now patients have shown improvements in glycemic control without experiencing significant side effects like gastrointestinal issues or hypoglycemia. It has proven effective in reducing the need for other diabetes medicine like and even basal insulin does in some cases. Its dual action on insulin sensitivity and insulin secretion, along with its mitochondrial mechanism, provides effective blood glucose control. Most important part to highlight is that Imeglimin ensures glucose-induced insulin secretion as well as protects beta cell and preserves beta cell mass. Moreover, like metformin, Imeglimin reduces hepatic gluconeogenesis and increases glucose uptake in muscles. Additionally, Imeglimin has shown synergistic effects when combined with other anti-diabetic drugs, making it versatile addition to the existing type 2 DM treatment regimens.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
So the clinical studies indicate that Imeglimin SR has a better safety profile like lesser GI side effects, with tolerability and efficacy also compared to metformin SR. As per the Indian study, with Imeglimin SR, there were 50% lesser GI side effects than metformin SR, whereas efficacy was at par. To share my own experience, I have used in some of my patients, has seen the benefits like better tolerability and able to reduce the dose of metformin 1000 mg BD to 500 mg BD.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
The mitochondrial function is crucial for cellular energy production and metabolic regulation. In type 2 diabetes mellitus, mitochondrial dysfunction is a common underlying issue that contributes to insulin resistance and impaired glucose metabolism. By targeting and improving mitochondrial function, Imeglimin addresses the fundamental aspect of the disease, helping to restore normal metabolic process. The unique approach not only aids in lowering blood glucose levels but also has the potential to improve overall metabolic health and reduce complications associated with T2DM.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
When it comes to safety, number 1, lesser GI side effect. Number 2, better tolerability. When it comes to efficacy, ideal for as an add-on on the reduce the dose of existing medication or insulin. Clinical studies have shown that Imeglimin has a favorable safety and efficacy profile with significant glucose lowering effects and a low incidence of adverse effects. Its ability to synergize with other anti-diabetic agents enhances its appeal for combination therapy. Additionally, Imeglin's potential to mitigate diabetic complications such as metabolic cardiomyopathy and diabetic neuroinflammation further supports its role in T2DM management.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, Imeglimin could significantly impact the future of diabetes treatment by providing a new mechanism of action that complements existing therapies. Its benefits in improving mitochondrial function and potentially reducing diabetic complication position it as a promising option for more comprehensive diabetes care. As research continues to unfold, Imeglimin may become a cornerstone in the management of T2DM, particularly for patients with complex metabolic needs. Imeglimin's favorable safety as well as tolerability and efficacy make it a valuable option in comprehensive treatment for type 2 diabetes mellitus.
Any other key points or take-home message you would like to share apart from this?
In my clinical experience, Imeglimin is very potential drug for lowering the glucose level. In the case of high HbA1c, like many of my patients, near about 10 to 12 patients had HbA1c level of more than 10. But within 2 months, uses of Imeglin and other drugs, other triple drugs like linagliptin, dapagliflozin, and metformin use, after 2 months, the reducing the HbA1c level is from 10 to 8 or some cases 7. It is very useful for HbA1c reducing.